New tonight, Herington Hospital medical records are on lockdown. After 104 years, the hospital there closed this month amid financial troubles.
But now that those doors are closed, so are patients' medical records. So the question remains, how do the people previously served by the hospital get their records?
A lot of you have been asking us. Brandon Stitt's been working to get you some of those details. So Brandon, what have we found?
Well, Mike, today I've talked to the governor's office, KDHE, the Kansas Hospital Association, a state senator, and the bank that is foreclosing on the property owned by the hospital. And we're trying to get the answers for the patients who tell us all they want are their medical records. After 104 years, Herington's hospital abruptly closed early this month. And with the doors now locked,
very frustrated all the way around. I mean, who wouldn't be? Because the older people, you know, like say, if they face an emergency situation, where do they go?
It's not only left people in the area without a hospital or clinic, their medical records are now locked up too. Former patients are now scrambling to find new health care providers, but they need their records, and so far, that hasn't happened. The governor's office tells us it's out of their realm because the Herington Hospital is not affiliated with the state. The Department of Commerce did reach out to provide resources to employees who lost their jobs after the hospital closed, but it was not involved in the granting of individuals access to their private medical records. State Senator Rick Wilburn, who represents that area, says he's been contacted about the situation. He's also been in contact with the governor's office and KDHE, and so far has no results. He also says the Kansas Hospital Association is working with the bank. And tonight, it's still unclear who exactly is in control. Emprise Bank said it's in the process of foreclosing, and the Hospital Association tells me that's who controls it. But the bank, late tonight, tells me it is foreclosing on the clinic owned by the hospital and certain personal property. It does not have a mortgage on the hospital itself, and it is not in possession of that property or the clinic. But it does say that it's working to protect what's inside. We'll, of course, continue to work to get those answers for those patients. Rachel.